different ways that we need to educate both physicians and patients. I think first is that these are not generics, and everybody thinks about them in those terms. But these are more complex molecules, and there are some subtle differences among them. We also need to educate people about the differences in the approval processes between generics and biosimilars. The analytics and totality of evidence is utilized for biosimilars and not as much emphasis placed on clinical studies. And that is what most physicians are used to looking at when they decide about whether to use a medication or not. So we need to teach people that this is about the molecules and the molecular differences and not necessarily about the perceived or potential clinical differences.
Now that biologics are in the marketplace and going off patent, we now have biosimilars are coming to the market. And I think it's critically important that both doctors and patients and pharmacists be educated as to what these drugs are, how they're used, etc. As far as how to educate them, I think the physicians, if they could have CMEs, continuing medical education, presentations on them, I think that would be excellent. I think advertisements, I think the medical journals, articles on them, whatever we can do to educate that doc how to use these medications and what they mean. Likewise, with the patient, I think there's a role for direct-to-consumer advertising here, either by the FDA and or the pharmaceutical companies. Going out, reaching out to those patients and advertising. Remember, the role of advertising is twofold. Number one, to inform, and number two, to persuade. Go out and inform the patient about biologics, biosimilars, follow-on biologics, and then persuade them that these are safe, these are effective, these are cheap, we can save money. There are many advantages to them. So I think that's the approach we need to take.